Hello, everyone. Welcome to our Zoom meeting. Today, we're gonna have different topics, and Dr. Haifa and her team will be presenting. So welcome to the Zoom meeting. Dr. Haifa, when you are ready, you can lead the Zoom meeting. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone, my name is Hayfa Ramadan, the leader of the Silver team. I am pleased to welcome you to today's meeting. We have a great lineup of presentation on available topics. Actually, today we are a multi-color team, so we have doctors from different teams, and I'm glad and I am welcoming them to do these presentations. So we will start with Dr. Mohamed from the Walnut team and Dr. Huzifa from the Blue team, who will discuss the pressure ulcer. Next, Dr. Amal Ahmed from the Walnut team as well. She will present on essential types of graphs and when to use them. Following that, Dr. Amena Eissawi will, from the Indigo team, will share insight of publishing articles on the Cureus journals of medicine. Finally, I will present on how to upload app on the Google Play Store with the 2024 criteria. So Dr. Mohamed and Dr. Huzifa, if you are ready, please, you can share your screen and start.
Yes, Assalamu alaikum. We are ready.
Okay, yeah, go ahead.
Okay. You see the screen?
Yes, yes.
Okay. Assalamu alaikum. I'm Dr. Huzifa. Today we will be discussing an important topic that impact the health and well-being of many individuals. Me and Dr. Mohamed Makkawi, we will go through this presentation exploring the epidemiology of the pressure ulcer, the key risk factor contribute to their development, and the clinical presentation and evaluations. Also, the differential diagnosis and staging system, and potential complications, and management and general care and monitoring. So, the pressure ulcer are injury that result from the prolonged pressure on the skin and underlying tissue.
Dr. Huzifa, just
Yes.
you are still, yeah, your slide is in the introduction, so I think you have to change the slide to the next one. Yes, this one. So,
This,
yeah.
yeah. Okay. By the definitions, pressure ulcer are defined by National Pressure Ulcer Advisory Panels by 2007 by the injury caused by the unrelieving pressure on the specific region of the skin and muscle in bed or chair or patients bound patients. It also called bed sores in other meaning. The time for pressure ulcer development is variable due to the severity of illness and number of comorbid. So about the epidemiology, it's affect to more than 1 million of adult patients and also high risk in older person because when person became older, it lack of blood supply to the skin will be decreased, and also epithelium layer flattening and will be more easily to be damaged, and also subcutaneous fat will be decreased, collagen fiber will be lose their elasticity, and will be tolerance for hypoxia decreasing. Okay, The prevalence in the US will be 10% to 18 in acute care, about 1 million individual per year, and cause of death around 60,000 individual per year, because the pressure ulcer cause another infection called opportunistic infection and more complication. And also one of the complication is trigger for sepsis by bacteria from the pressure ulcer entering the blood stream. About the statistic, 70% occur in people over 65, and most common site, we'll talk about the site in next slide. The most common was sacrum and heel, also shoulder, heel, ear were favorite site for newly developing pressure ulcer. This is the prevalence of the pressure ulcer settings. These will be found in the US. In hospital settings, the prevalence of the pressure ulcer will be from 1 to 30% of all individuals in the hospital. In home care, it will be 5 to 15%, and nursing home will be 3 to 30, 60 to 30%. The home nurse and the hospital will be high prevalence, because from hospital will be there is a patient in the ICU, and something like that will be more susceptible to be became a pressure ulcer. And also from her nursing home, from the bedriddens. This is a prevalence according to the stage. There is stage 1, stage 2, stage 3. The greater one was stage 1. It represent about 47%, and stage 2, it present about 33, and stage 3 and 4 will present 20%. Then we'll talk about the risk factor. All the other have much high likelihood of developing pressure ulcer due to their risk factor. There is an intrinsic and extrinsic risk factor. Intrinsic risk factor are the physiological factor or disease status that increase the risk for pressure ulcer developing, and the extrinsic risk factor are the external factor that damage the skin from the external stimuli. This is intrinsic risk factor. The most intrinsic risk factor was age, plus 70, older patients. Number 2, impaired mobility and current smoking. Smoking, one of the greatest risk factor also. Low BMI and confusions. Urinary and full incontinence in the stroke patients. Also malnutrition and recent. Also comorbid condition like malignancy, diabetes, stroke, pneumonia, congenital heart disease, fever, sepsis, hypotension, renal failure, dry skin, history of pressure ulcer, or anemia, lymphopenia, and hypoalbuminism. All of them was the intrinsic risk factor. About extrinsic risk factor, the first one was alcohol and drug abuse, fraction cheese, pressure, and inadequate current wound care for elder patients, and also immunosuppressant have high success couple, and chemotherapeutic agents, nutrition and deficiency, and also patient with uncontrolled excess local pressure and adverse reaction to skincare product. Also, smoking here, one of the extrinsic factor, and the focal and urinary incontinence. About the sign and symptom, the clinical presentation of the pressure ulcer. The sign and symptom will be presenting by foul odor from the ulcer, and redness, tenderness around the ulcer, and warm swelling. This is a sign of the inflammations plus fever, and weakness and confusion of the infection spread to the blood and other body. The clinic will present by rounded critical-like shape with regular edged over bony prominence, but can take other shape of the bone, like malleus and sacrums. Usually dark regular beds that do not bleed easily. About 95 over sacrum, this is the most common site, and coccyx, trochanter, and heel lateral malleolus. This is a common locations. The differential diagnosis is important to distinguish ulcers that are due to pressure from the other ulcer related to diabetes, arterial insufficiency, or venous insufficiency. However, these also predispose to developing of pressure-induced injury. And many wounds, particularly in the lower extremities, have multifactorial etiology to develop that, like a venous ulcer, a diabetic foot ulcer, ischemic ulcer, and wound and ulcer associated with malignancy. All of them was a differential diagnosis for the pressure ulcer. This was the location of the pressure ulcer. As we say, over bony prominence, first of all, in the occiput, it depends according to the patient positions. Okay, we'll talk about it. First one, in the occiput, ear, scapula, spongious process, shoulder, elbow, iliac crest, sacrum, and ischial tuberosity, trochanter, knee, and malleolus, heel, and toe. These are all location of the pressure ulcer. The most common location is depend on the position. If patient was supine position, the most common locations will be head, shoulder, elbow, buttock, and heel. In buttock and the sacrum, this is the most common locations, as we see 95% of the pressure in the hospital. If patient was pronate positions like this, the most common location will be elbow, rib cage, and thigh, knee, and toes. If patient was in lateral positions, the most common location will be ear, shoulder, elbow, hip, thigh, and leg, and heels. A number of staging, we will talk about the staging system. A number of staging systems have been developed to describe the extent of pressure-induced injury to the skin. The most common used system from the National Pressure Injury Advisory Panels is suggest using terminology pressure injury to describe this wound, and given that lesser degree of skin damage due to pressure may not be associated with skin ulceration. An intended consequence of numerical staging in manifesting misinterpretation that stage impel progression or regression of the disease. The National Pressure Injury Advisory Panel staging do not apply the stepwise sequence of other detection. We will show the stage according to these advisory panels. As we know, the skin is composed of epiderm, derm, and subcutaneous tissue. It's according to the stage will be deeper. This is stage 1, the superficial. Stage 2 will be more included derm or epiderm. Stage 3 will be more subcutaneous tissue, invasive. So about the stage 1, it persists non-plant couple erythema or of intact skin in older. It depends on the skin color. In dark skin, tone usually may be appear with persistent red, and also blue or purple tones. Most commonly of all pressure ulcer. This is the most common stage present in the hospital at risk of arson. Stage 2, it will be partial thickening thickness skin losses involve either epiderm and derm, or both of them. In this stage, ulcer is superficial and present as an abrasions and blister or shallow cricket. This is the picture of the stage 2. It will be as you see, the blister here. Stage 3, it will be full thickening skin loss involving damage or necrosis of subcutaneous tissue that may be extended down to, but not through the underlying fascia. As we see here, we present like white and red necrotic tissue. This is stage 3. Stage 4 will be full thickening skin loss with their extensive disruption, tissue necrosis or damage to the muscle bone or supporting structure like tendon, joint capsule, undermining and sinus tract may be also present. It will be deeper like this. This is stage 4. There is one of the stage will be unstageable. It present like this, like in the black. It will be full thickening tissue loss with which slow. It will present with yellow, tan, gray, green, or brown color. Both of the wound will be covered at the base of the ulcer. It will be black. Most of unstageable pressure ulcer will be presented as black. So the important notes, the wound should be staged according to the deepest extent. An example, also, the majority of wound may be stage 2. Any portion that extend deeper classify the ulcer as high stage. Stage 3, ulcer can be shallow in area without subcutaneous tissue, which include the perdage of nose, ear, occiput, and malleolus. By contrast, the gluteal region and develop very deep ulcer like stage 3 and stage 4. The extent of stage 4 ulcer is often underestimated due to the undermining and fistula formations. Fistula formation will be in stage 4. And also relatively small superficial skin defect may be masking extensive deep tissue necrosis. In stage 4, ulcer also extend into supportive structure, including fascia, tendon, and joint capsule may be associated with osteomyelitis. This is one of the complications that when patient became stage 4 will present as osteomyelitis. And also deep tissue pressure injury may be difficult to detect in individual with dark skin, as we say. The area may be painful, firm, or spongy, boggy, or warm, or cold compared with surrounding tissue. This is a sign of the inflammation, as we say. So, the possible complication, if the bacteria spread to the blood, will lead to septicemia. It will be aerobic and anaerobic bacteremia. It called localized infections, also cause cellulitis, and if became stage 4, will cause osteomyelitis. The pain was one of the prominent manifestation of this disease, and also lead to depression from the mortality or morbidity. The mortality rate was 60 in older person who develop a pressure ulcer within the 1 year of hospital discharge. This will be high mortality. From here, Dr. Mohamed Makkawi will continue with you with evaluation and monitoring and managing the pressure ulcer. Dr. Mohamed.
Hello everyone, my name is Dr. Mohamed Makkawi from Team Walnut. So I'll be taking over. So until now we have been talking, Dr. Huzifa has been talking about staging, and so we're what we're going to take it from here is how to evaluate pressure ulcer wound and how to manage it. So the management begins with the clinical assessment of the wound and the assessment of the general condition of the patient, including any medical conditions and if there is any reversible conditions that can be managed. Then we will also have to evaluate the wound itself to check for if there is any for its length, width, and depth, and if there is any presence of sinus tract or necrotic tissue or presence of granulation. We'll also take photographs so that we can observe any feature, how it's changing, and then based on this, then we can stage the lesion. So another thing is pain is one of the most important complications of pressure ulcer. So we have to take care of its pain, and pain assessment should be performed in all patients with pressure-induced skin and soft tissue injuries. Okay. So one of the complications of pressure ulcer is infection, and infection itself impairs wound healing. So whenever you have an infected wound that is not healing well, infection should always be in the top differential, even if there is no systemic signs such as fever and leukocytosis. And usual infections can present with just local signs of soft tissue involvement such as wart and erythema. However, they can manifest variably depending on how deep the wound is. And sometimes only the delayed wound healing is the only sign of infection. Many times, the pressure-induced skin and soft tissue injuries can be a reservoir for resistant organisms such as MRSA and vancomycin-resistant enterococci. And they can be colonized, and infected also can cause a potential risk, especially for those who are immunocompromised and for other hospitalized patients. And precautions should be used when you're examining and treating the ulcers. So, general, how do you take care of the patient? First, we'll try to reduce any contributing factors that can lead to the pressure ulcer, such as providing pressure redistribution with proper positioning and support surfaces, and will provide appropriate local wound care. In many hospitals, they have dedicated wound nurses that follow up with these wounds and do daily dressings as required. And the management, they also include debridement of patients of necrotic tissue based on its characteristics, and then monitor the development of the patient's progress and provide appropriate psychosocial support, which is usually commonly not taken care of a lot. So pain control. Many of the patients who usually develop pressure ulcer are usually of the elderly, and they may not be able to express pain well. So adequate pain relief should always be provided, as these injuries can be quite painful. So conditions that lead to pain, such as ischemia and infection, should be addressed. So we should always have an initial pain assessment as well as an ongoing pain assessment using a pain scale from 0 to 10. And assessment should be aimed at identifying the type and extent of pain, so the appropriate therapy is given. Pain can be intermittent, which changes from time to time, or could be continuous, present all the time. We usually always start with the pain ladder. We start with the mild or non-opioid pain medication, and if it is severe, we'll go for opioid analgesics. Okay. Then we have to treat infection. All open ulcers, they're usually colonized for bacteria, but we don't always have to treat them. So only those which are clinically evident, where there is redness, hotness, or the patient is systemically unwell, it has to be addressed with culture and antibiotic treatment. The presence of bacterial biofilm can impair wound healing. So those with deep wounds should be evaluated for the presence of osteomyelitis. Then nutrition. Patients usually with pressure-induced skin and tissue, they're usually in a chronic catabolic state. So they will require both protein and increased protein and total caloric intake, particularly those with stage 3 and 4 pressure ulcers. Nutritional intake should be assessed by nutritionists, and it can be done with assessment with protein and caloric intake, hydration status, and serum albumin, and total lymphocyte count. Of course, we also have to correlate with and lab markers by themselves are not a sufficient marker for nutritional status. Retrospective study was done with 882 patients, demonstrated that total caloric intake of at least 30 kilocalories per kg promoted healing and decreased the size of stage 3 and 4 wounds. So an increased dietary protein also promotes healing. Data does not support the use of routine to supplement patients with those without nutritional deficiency. Vitamin C and zinc supplementation are commonly used to promote healing, but their efficiency has not been established. One of the most important ways of managing is, of course, redistributing pressure. Proper positioning and support to minimize tissue pressure should be provided for all patients, especially those with open wounds. And development of any new areas of damage should prompt review of the method and intensity of preventative measures. Till date, there is no randomized trial available to identify whether positioning by itself makes a difference in healing rates. Nevertheless, in the absence of data, it is still good practice to position patients to minimize or avoid pressure at all on the wound. Pressure relieving support surfaces are also helpful in reducing tissue pressure. So now we're going to focus on the wound itself. So wound management is according to general principles, which include debridement of necrotic tissue and appropriate dressing and wound package to promote healing of the wound bed and wound coverage when indicated. So specific regimens for stage 1 skin injuries, they should be covered for protection. Stage 2 generally need little debridement and require dressing that maintain a moist environment for granulation. And stage 3 and 4 usually require debridement of necrotic tissue and possibly treatment of infection. With appropriate wound bed preparation, coverage may include skin grafting or other tissue transfer procedures. So how do we monitor them? Therapeutic goals should be set that consider discharge, quality of life, treatment preferences, and prognosis. With appropriate care, most pressure-induced skin and soft tissue will heal within expected time frame. 2 studies showed that 50% with stage 3 injuries and 30% with stage 4 injuries were ulcer-free at 6 months with standard wound care. Among those who followed over 2 years, 77% of stage 4 pressure injuries have healed. So the following parameters should be monitored daily and documented about the evaluation of the ulcer, the status of the dressing, if any present, status of the area surrounding the ulcer, if there is presence of any pain and adequacy of pain control, and presence of any possible complications such as infection. Okay, so this is a table to show how do you score, how do you find out the status. If there is any exudate, we give a score of, if there is no exudate, it's 1 up to 5. And the skin color, if it is pink to black, peripheral tissue edema, and if there is any induration or presence of granulation tissue, and epithelialization. Okay, so in summary, older adults are at high risk of development of pressure ulcer, and pressure ulcers may result in serious morbidity and mortality. And techniques that reduce pressure, moisture, friction, and shear can prevent pressure ulcer. Pressure ulcer should always be treated with proper cleansing, dressing, debridement, or surgery as indicated. These are the references for the slides, and thank you very much for this presentation. If you have any questions, you can post it in the chat box. We'll be happy to answer.
Thank you, Dr. Mohamed and Dr. Huzifa for this presentation. If anyone would like to ask any questions for Dr. Mohamed or Dr. Huzifa, please feel free to ask them. Okay, now we will go with Dr. Amal from the Ahmed from the Walnut team, and she will present the essential type of grafts and when to use them. Dr. Amal, are you ready?
Yes, I'm ready.
Yeah, go ahead.
Give me 1 second.
Yeah, take your time.
Are you able to see my my screen?
Not yet.
Okay, just
Yes, now it's, yeah.
all
Go
right.
ahead. Yeah.
Hello everyone. I am Amal Mohammed. Today we are going to explore essential types of graph, focusing on how and when to use them, especially in medical and healthcare context. Let's start with what graphs are. Graphs are visual representations of data that simplify complex information and reveal patterns, trends, and relationships. Why they matter? Visuals are critical in medicine for tracking patient outcomes, research, and making informed decisions. The right graph can make data interpretation faster and more accurate, which is key in healthcare. First, let's look at bar graphs. We use them to comparing medical test results and displaying categorical data such as number of patients diagnosed with a specific condition. So we use them for categorical data to show how different categories compare quantitatively. I do have an example here. Oh, I'm sorry. So this is an hypothetical exam of bar graph showing flu cases in different age groups. So this is a different category. Each age group represents a specific category from 0 to 4, from 5 to 17. I have a missing number here, but we can imagine this is a 0, 10, 20, 20, 30, 40, 50. So from 0 to 4, this age group, we do have a 25 case of flu. From 5 to 17, for example, we do have a 45 case of flu. Next, we have pie chart. We use them to showing the distribution of medical conditions in a patient population, best for visualizing proportions such as percentage of patients with different types of cancer. It's best for a small number of categories, ideally 5 to 6. Too many slices can make the chart hard to interpret. It's also very simple to understand the pie chart. So it's when you have an audience from outside of medical field or who cannot understand the complex chart, pie chart is a very useful tool for them. Here's an example of a pie chart showing allergies type in a sample of patient population. For example, we do have a 15 patient, they do have an allergy to drug, 25, they have allergy to food. Now we can move to line graph. We use them for tracking patient progress over time. And we also use to show trend in medical research. So it's useful for numerical data that change over continuous variable. Usually the continuous variable is the time. Here is an example of a line graph showing a blood pressure, a patient's blood pressure over a month. So we do have a systolic blood pressure in yellow line, and diastolic blood pressure in an orange line. One of the advantages of line graph is excellent for showing trends and pattern. So it's useful for tracking progress or fluctuations. Scatter plot are showing the relationship between two variables such as age and blood pressure, best for identifying correlations. Example, does body mass index correlate with the cholesterol level? I have a chart showing this. So this is the BMI. This is a scatter plot. We have an x-axis and y-axis. We use them for a numerical data. BMI is a numerical, and cholesterol level also it is a numerical. We make a plot with each. For example, here 20 have a 180. Sometimes the correlation can be a line correlation, which is make the interpretation very easy. Sometimes it's a scatter like this one. Also, it is very useful for spotting outliers or anomalies in data. So if you have a line plot or thing, and we have a data here, so it is an outliers. So it is very useful for identifying the outliers. Histogram. Histogram, we use them to display the distribution of patient data, best for continuous data like age, weight, or lab results. Here's an example of histogram. And the histogram is very useful when we do have a large set of data. So we use the histogram for numerical data. The number of patients is a numerical data and age is numerical data. The difference between histogram and bar chart is that for bar chart, we use a categorical data. But in histogram, we do use numerical data. It's continuous data. Area chart. It's very useful for showing cumulative data, such as patient recovery rate over time. It's similar to line graphs, but emphasize the magnitude of change. Here is an example of area chart showing the cumulative admission date over month. Here the admission admission frequency, and here the days. Box plots. We use them to show in data spread such as variability in patient lab result, great for identifying outliers in clinical trial or patient test result. A box plot showing distribution of systolic pressure among hypertensive patients. And I have an example of a box plot showing hemoglobin levels in patients with anemia. So here is the most patients with anemia, their hemoglobin level lies between 9 and 11. And this is an outlier patient with hemoglobin level of 6. Lastly, I do have a fishbone. We use them for root cause analysis in healthcare. Example, identifying the cause of medical errors or adverse events. It's used for breakdowns factor contributing to a problem. Here is an example of a fishbone diagram. We do have the problem here. So what is the factor that contributing to this problem is people, management, environment, materials, equipment, and process. And we can break down each category to a smaller category. Let's move to an important app for making graphs. We have Microsoft Excel, a versatile tool for creating basic graphs like bar, line, pie chart. A graph pathbase, popular in medical research for creating detailed scientific graphs, including survival curve and scatter plot. Tableau, ideal for a large data set and interactive data visualization. R and Python, useful for advanced statistical analysis and highly customizable graphs. And lastly, we do have Google Sheets, accessible and great for quick, simple graphs. To warm up, choosing the right graphs is essential for accurately communicating data. We have covered how and when to use different types of graphs, from bar and pie chart to more complex options like scatter plots and box plots. Remember, graphs are a powerful tool in healthcare, helping us understand data trends, patient outcomes, and public health statistics more effectively. Any questions?
Thank you, Dr. Amal.
Thank you.
Any question for Dr. Amal? Statistic graphs is important to summarize your, for example, research or your studies, and there are many ways to do this, as Dr. Amal mentioned. If you have any questions, please feel free to ask her. Otherwise, we can go to the next topic, which is how to publishing articles in the Cureus journals of medicine will be presented by Dr. Amena Eissawi. Dr. Amena, when you are ready, you can start.
Thank you, Dr. Hayfa. Assalamu alaikum. Good evening or morning, everyone. Today I'll be presenting about publishing articles in the Cureus Journal of Medical Science. Can you see my screen?
Yes, we can see your screen. Yes, you can start.
Thank you. My name is Amena Eissawi. I'm an alumnus of Razi University, Sudan. I'm a member of the Indigo One team and have been a fellow in the TGRF since last May. Okay, so first of all, I'm going to start. I'm going to give you an overview of the presentation. First, I'll be starting by introducing Cureus as a journal, and then I'll be breaking down some of the important points from the author guide website and from the author instruction website. Then after that, I'll move on to give you a step-by-step overview of the peer review process, and then we'll reach the end of our presentation, inshallah. Okay, so first of all, I'll start by introducing Cureus. Cureus is an open access, online-only, multi-speciality medical journal established in 2009. It joined the Springer Nature since 2022, and they're now published by Springer Nature, which is a well-known publishing entity. It's based in San Francisco, California. As you can see, it's very known for having a very fast or a very short time of processing the articles and publishing them. They have an average time of 1.4 days to get the first decision of whether the article is appropriate for publishing or not. And they have a median of 26 days, which is less than 1 month to publish an article. They have an impact factor of 1.1, which is not very high compared to other journals, but not very bad as well. And they have a total of 60 case citations. They're PubMed indexed, which is very important. They have an average monthly reads of 3.4 million, acceptance rate of nearly half, which is 52%. Not nearly half, but more than half of the articles. They have a 31% of accepting 31% chance of accepting articles for publishing for free. They have a very wide variety of specialties in which they publish under, as you can see from here, from allergy and immunology to biostatistics to clinical specialties to some of the preventative medicine and hospital-based medicine and so on. Okay, so why should we use Cureus to publish our articles? The advantage of using Cureus is that it's broad scope, as we could just see from their website, screenshot of the variety of subspecialties that they accept. They accept diverse articles, article types across numerous medical specialties. It's cost effective, as you can apply for free publication. And if you're eligible for the free publication based on their criteria, you will get your your article published for free. Otherwise, they have affordable editing services if your publication needs some editing. It's open access, which is a part of their vision, is to make articles more accessible. So it maximizes, which can maximize your the global visibility and impacts of your article. They have an efficient review process that's rapid. However, as we know, everything has some advantages and disadvantages. So when we come to weigh the scale of whether you or us or everyone should publish on Cureus or not, it's important to keep in mind that the lower impact factor that the journal has may limit the visibility and citations, and the fact that it could have a low perceived prestige because of the rapid publication and the open access model. Okay, I just wanted to note that they accept 5 types of articles, which are original research, review articles, case reports, technical reports, and editorials. They do not accept conference proceedings and abstract. They do not accept theses or dissertation chapters. or letters to the editor. They also don't accept meta-analysis or systematic reviews unless they're exceptionally well executed. We're going to talk in details about the criteria needed for each one of the accepted articles. Okay, so first, I'm going to start by summarizing some of the important points of the author guide section. As we know, most of the journals online will provide you with the website that talks about the author guide, which gives some sort of instruction to the authors on how to submit the article and how to use their online system of submission, and some author instructions as well, which are very important to go through before publishing an article at any journal. Okay, regarding the Cureus's author guide, we will start first by talking about the accepted articles. Okay, so the eligibility criteria in general includes having an original article or case report or technical report, an editorial that are all of those are eligible for free publication if they meet the Cureus editorial requirements. They something that I failed to mention in the introduction, that they have various channels in which certain societies or medical departments publish their articles through their channels, and they do host competitions every once in a while. So for all of the non-channel and non-competition view articles, it's required to purchase the preferred editing service, which is a service provided by Cureus. Okay, we're going to go through or skim through each article type individually. First, starting with original articles. Original articles are defined as original research and are considered primary literature. Cureus considers case series with 6 or more cases as retrospective studies, and they require to submit that as an original article. The sections that are required to be present in original articles are abstracts, introduction, materials, methods, result, discussion, conclusion, and references. In order to qualify for free publishing, you have to have a maximum of 10 authors and 30 references in your original article. It's important to note that Cureus is very selective about accepting survey-based or questionnaire-based methodologies concerning the general knowledge, awareness, and attitude without a clear scientific impact. So if your research or your article uses the same methodology of studying the general knowledge, awareness, and attitude via a questionnaire, you should be very careful if you're submitting the article to Cureus, or maybe consider other journals. Next is review articles. Review articles gives an overview of existing literature in a field. They often identify specific problems or issues, provide a balanced analysis derived from available published work on the topic. So basically, you review the available literature, then you give an overview of the current problems or issues. The sections to be included in Cureus are introduction and background, review, conclusion, and references. Those sections are relevant because when you are submitting the article online, they require you to have those specific set of sections. So they want you to have the manuscript tailored into those sections. In review articles, there is no specific limit of author and reference limits, because regardless, it's required to purchase their preferred editing service for all of the review articles. Next is case reports. Case reports basically present the details of real patient cases from medical or clinical practice. They're expected to discuss the signs, symptoms, and diagnosis diagnosis and treatment of a disease, the sections that are required in the series for the case report. It's required to have an abstract, introduction, case presentation, discussion, followed by conclusion and references. In order to qualify for free publication, you have to have up to 5 authors, the maximum of 20 references. If you ever go beyond the limit, beyond 5 authors and beyond 20 references, or beyond any limit for author and references in any of the other articles, you may need to pay for it, or your article will not be eligible for free publication. In case of case reports, please note that case series of 5 cases or fewer must be submitted as a case report. As we said previously in the original article slide, original articles also include case series of 6 cases and more. Now, in order to have case reports, it should be up to 5 cases, or it could be less than that. Another interesting concept that I have not really heard of before is the autobiographical case reports. Basically, it's an autobiography and it's a case report at the same time. These must include a physician as an author or co-author. Okay. Articles featuring both case presentation and literature review must be submitted as a case report, so it cannot be submitted as a literature review or a review article. Okay. Lastly, if the case has any MRI, CT, X-ray scans, or any sort of radiological imaging, it should be mentioned in the case report, and it should be included in the article unless it shows nothing of interest. So if there is a finding in any sort of imaging from the case, it should be included in the case report. Next are technical reports. A technical report or a scientific report is basically a document that describes the process, progress, or result of a technical or scientific research, or the state of a technical or scientific research problem. So it's basically a technical report. You talk about the technicalities of certain procedures and so on. The sections to be included are abstract, introduction, technical report itself, and after that, discussion, conclusion, followed by references. In order to qualify for free publication from Cureus, you should have, or you can have up to 5 authors and 20 references. Lastly is editorials. Editorials are opinion or perspective pieces on relevant timely topic. So it's basically an article in which a physician or a researcher talk about their opinion or their perspective regarding a relevant topic. The sections should be abstract, editorial, and then lastly references. You can have up to 5 authors and 5 references. It's very important to note that editorials will only be approved if submitted by senior clinicians or researchers with an established Cureus publishing history. So not everyone can have not everyone is eligible or have the privilege to publish an editorial at Cureus. Okay, we're going to talk about the non-accepted article types. There are basically 4 types of non-accepted articles. The first is articles on medical student, resident, or physician burnout. Sadly, because this is a very common topic that has been included in recent studies. However, Cureus does not accept those types of articles. All articles related to stress, anxiety, or burnout of medical students or professionals will be rejected. Mini reviews are not accepted at Cureus. All review article submissions should be comprehensive and include all of the relevant literature. So sadly, if you want to do a mini review, Cureus is not the right place to publish it because they do not accept them. Review protocols are also not accepted. That also includes systemic review protocols and so on. Lastly, letters to the editors are not accepted or published in Cureus. Okay, so in order to have a better chance of getting your article to be published for free, you should know the focus of the review, which the journal focuses on. First of all, you should ask yourself, is this article well drafted and scientifically credible, which we will talk about shortly? And then, is this article well drafted? Yeah, it's the same question. And then you'll ask yourself, are there errors in the following areas, which is the most common types of errors? Firstly, starting with reference formatting and accuracy, media quality, formatting, labels, and placements, the spelling, grammar, syntax, and punctuation errors, the errors in author names and affiliations, errors in text and article formatting, proper use of acronyms and initialisms. It's very important to go through these and make sure that there are no issues or errors in those areas before you publish before you submit your article for publication. Cureus will only accept well-drafted, not accept, but accept for free publication, the articles that are well-drafted, relevant, and credible, with minimal errors. Those are the ones, or the only articles that will be accepted for free publication. Regarding articles with significant errors, those articles must use Cureus's preferred editing services, which for which they have a free fee calculator for in their website. Lastly, articles with major language problems requiring professional third-party editing will be redirected for professional third-party editing before the peer review and free publication. So if the article has major language problems, they could still be eligible for free publication. However, you would need to use the third-party editing. Okay, now we have gotten some idea about what to expect, and I have reviewed some of what I think are the main points, the author guide. We'll move forward to the author instructions. Firstly, we'll start by discussing author roles, and then I'm going to give you an overview of submitting an article, the actual process of submitting. Okay. Firstly, it's very important to know that authors cannot be added post-submission or publication, and withdrawals could be allowed for resubmission with new authors, but in this case, you will need to purchase the preferred editing services. All of the submissions must include a senior author, which is basically identified by Cureus as MD or DO, who completed their residency training, PhD author, NB author, which is nurse practitioner, BA, RN, registered nurse, or DDS, dental or dental medical, DMD. No LLM, which are the tools such as OpenAI and ChatGPT. No such tool will be accepted as credited authors for an article. So while you may be able to use those as for assistance while you're drafting your manuscript, you cannot add them as credited authors for an article. Okay, so we have two important roles that I want to discuss here, which is the submitting author and the corresponding author. And then I'm going to talk briefly about first co-authorship. Okay, submitting author assumes full responsibility for the submission, peer review, and publication. Only the submitting author can edit the article for authorship, contribution, and affiliations. If someone is submitting for another author, which I do not recommend, and the journal does not recommend as well, you have to log in with their account, and all the notification will go to the submitting author. Yes, and the article recommends authors to submit their own work. The submission process is very easy. It does not really need to have someone else submit the article for you. Okay, next is the corresponding author. Submitting author may designate a co-author to serve as a corresponding author after the article is published. The corresponding author, as the name suggests, can only communicate and answer relevant questions about the article and communicate with the journal. They do not have the privilege or the access to edit any of the authorship, contribution, or affiliation, or the manuscript information. Okay, regarding first co-authorship, Cureus does not support first authors. It does not support the assignment of two authors to be first authors. However, if someone wishes to recognize two first authors, they can add that they can add a statement to the acknowledgement section saying that both author A and author B have contributed equally to the manuscript, and they are to be assigned, or they are considered as first co-authors. Okay, this is the most important part of the presentation, which is about the actual process of publishing articles. First of all, these are basically the steps that you will encounter online. Some of the things regarding for adding media and all of most of the technical stuff that you will need to put in mind while entering the information about your manuscript in the Cureus online submission system. Firstly, you have to select the article type. As I said previously, they have channels in the Cureus article, which basically some societies, scientific societies, publish their papers basically through channels in Cureus. They have competition frequently. You have to select whether your article is to be published in a specific channel or a competition. If it's an original article, review, case report, technical report, or editorial, so you have to select the article type. This choice at this point is final. So once you select your article, for example, is related to a certain channel or is an original research, you cannot change this in the future. You can change many of the other stuff. You can change the title you put, you can change the authorship, the references, you can edit them, obviously before submitting. But once you choose the article type, you cannot change this moving forward. Next is regarding the title, abstract, keywords, and categories. After selecting the article type, you will move on to enter the title of your research, which should be in the APA style, which I will show you a picture of. It should be title case. Again, I will show you a picture of that. And it should only be one sentence. So you cannot have a title that composes of two sentences. After that, you will add the abstracts, keywords, and categories. Now, it's important to note that you should not enter the title in all caps or include a period at the end. So do not put a dot or a period at the end. Acronyms, initialisms, or abbreviations are not permitted in the article title. However, there are some exceptions which include the common abbreviations such as COVID-19, HIV, and MRI. Those type of abbreviations can be included. Now I'm going to show you a picture of the APA style title. It differs because it could be used for assignments for college students, or it could be used in scientific research as well. Now this is how the title should be. As you can see, the APA style title case includes having the first letter to be capitalized and then having capitalization of most of the words except of the words that are less than three, the words that are less than 3 characters, such as off, as you can see here, or in. And then you add the authors down. You put the affiliations numbered, and then you put the author affiliation, and then you can write some author notes at the bottom of the title page. The page number should also be included, and if relevant, you can add a running head. This is how the title page should look like. Now, regarding the abstract, you would have a character limit of 3,500 or 3,500 characters. The abstract in the original articles are the only place where you're permitted to add subheaders, such as writing background. If we're talking about the background, writing background as a sub heading, or methods, for example, objectives, for example, conclusion and result. The abstract in the original articles are the only place where you're permitted to add, or you're allowed to add subheaders. After that, after adding the abstract, you are to choose the categories which relate to your article. For example, cardiology, if the article is about hypertension management, for example, you can add cardiology as a category. Hypertension and so on. You should choose between from 1 to 3 article categories, and then relevant keywords, which are from 5 to 10 keywords. Keep the keywords short, so it's preferred to have a maximum of 3 to 4 words each, the keywords, and as specific as possible. Okay, after that, you will move forward to adding your author list. You should add all of the co-authors before submission, because you cannot edit this later, as we said previously. Submitting author is put as first author by default. You can change the order, so be very careful if you're not the first author and you're submitting the research. Just be very careful and not to miss this point. You can edit the names and affiliations of the authors. Those cannot be changed post submission, so be very careful when adding this information. Make sure to have consistent affiliation formatting. For example, have the MPBS as all caps, or whatever affiliation you're writing, just make sure that the affiliation is consistent. For medical students, they should use medical school as their institution. And then in the department, they could add relevant category, which is the category in which the research is relevant in, as their department. No titles should be added in affiliation, so do not add Dr. or Miss or Mrs. So-and-so. Authors from the same institution must have identical names and format. When one author or more have multiple institutions, are from the same institution, you should make sure that you write the institution's name identically in all of the authors. Of course, when they're from the same institution. If there is inconsistent formatting, you may require the preferred editing service. No suffixes should be used for seniority in author list. So no suffixes such as so-and-so junior the first, or junior the second, or so-and-so senior. So you're not allowed to add these suffixes. Contributions. Okay, so all of the authors must meet the International Committee of Medical Journal Editing authorship criteria. The ICMJA authorship criteria basically is the agreed upon criteria in which an author is defined, which we'll discuss. You have to check the contributions of all of the authors via drop-down. For example, if an author contributed to the analysis of the paper or the supervision of the paper, it should be checked. Other authors should be acknowledged. So if you have a person who contributed to the research that does not meet the ICMJE criteria of authorship, they should be added to the acknowledgement, but not to authorship. They do not reach the criteria. Okay, so regarding the criteria, this is just gonna go briefly over it. The Cureus adheres to the uniform standards set by the ICMGE. For authorship, the author should have substantial contributions to the conception or design of the work, or the acquisition, analysis, or interpretation of the data for the work. And they should have contribution in drafting the work or reviewing it critically for important intellectual content, which is for plagiarism, basically, and they should have approved of the final version to be published, and they should have agreed to be accountable for all of the aspects of the work, in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. So basically, contribute to the research itself, draft or help in drafting the manuscript and checking that no plagiarism there's no plagiarism in the work, approve of the final version of the publication, and agree to be accountable for the content of the manuscript. Now, as a submitting author, throughout filling the online system of submission, you have the role of informing co-authors upon submission, manage correspondence and updates, obviously, unless if you have a corresponding author which can take this task, declare conflicts of interest, and ensure compliance with policies. The policy section is very long and tedious. I did not want to put it into this presentation to not make it long, so you can check it in the website. Those are the roles of the submitting author. The corresponding authors we discussed previously can address the queries related to the article, but they cannot change or edit any of the sections related to the article. Okay. General supervision or funding to a research does not qualify as authorship. Those are the type of people you may put in the acknowledgement, but you cannot write as authorship. Contributors not qualifying for authorship may be acknowledged. As I just said, they could be added to the acknowledgement. If there are any disputes around authorship, they should be resolved among authors, not the journal. If there are any disputes about who to put as an author or who to put as the first or second or the order of authorship in general, this should be resolved among the authors themselves, and the journal should not be contacted regarding this. After that, you will be asked through the online system to disclose if there was any human or animal subject, and if there is any conflict of interest. Basically, if any of the researchers have been getting some financial advice or have any interest regarding these specific, for example, medication they're writing research about, you should include the IRB names, which is the Institutional Review Board, the board that gives a research the ethical approval, and the approval number of the research, and confirm that you have written, obviously, it includes humans and animal subjects, and informed consent from the human subject. Submitting authors must disclose all co-authors' conflict of interest. So the journal is not going to contact all of the co-authors to get the conflict of interest separately from each one. All of this is to be disclosed by the submitting author. You could, however, email the co-authors for info unsure. The conflict of interest may include third-party payments. For example, if you get a payment from a third party, or if you have outside financial activity. For example, if researchers are conducting a research about some, let's say, medication from a certain company, let's say Pfizer, for example, if they have some financial activities related to that company, if they get third-party payments, if they have relevant patents related to that company, or if they have unlisted relationships with the members of this specific company, for example, the specific drug company, this should be identified, it should be put in mind as conflict of interest. Cureus will generate an ethics statement and conflict of interest disclosure based on the provided information. Excuse me. After that, you will start writing the main article content. It's preferred to write it in a word processor such as Microsoft
Are you able to hear Dr. Amna or just lost of connection just for myself? Dr. Amna, unfortunately, we cannot hear you. Are you still here? Yeah, I know. Okay, we'll just wait for 1 minute. Just give her time. Maybe she just lost connection. Otherwise, I will start the last presentation.
Hello,
Okay,
everyone.
Yeah,
I'm very sorry. I had an issue with my internet connection.
no worries. You can continue.
Okay, thank you very much. Okay, going back to where we stopped. Okay. As I said previously, said that publishing conference proceedings is not accepted in the Cureus journal. However, if you have a research article, that's one of the accepted types that you have presented as an abstract or a poster in a research, you can also submit online for publication. Sorry, that you have presented as an abstract or a poster in a conference, you can submit it as an article in Cureus, but you have to mention that it was presented as either an abstract or a poster, and you have to include the meeting title and date. If an article was previously posted in a preprint server such as medRxiv, you should also mention that, and it's accepted if the article is not pending full publication elsewhere. So if it's only posted on a preprint server, you can still publish it, of course, provided that it's not pending full publication elsewhere. Now, regarding the formatting of the article itself, okay, there are a lot of points that you should put in mind. What I perceive to be the most important. First of all, You should not have paragraph indents or bullets. So do not include bullet points in the manuscript. You can have one return after paragraphs. So one, basically leaving one empty line, for example, after the paragraph, one space between sentences. Obviously, after the finish of the sentence, only have one space, not two, not more than that. And you should remove text styling before pasting the manuscript into the online submission system. Regarding the nomenclature of bacteria and genes, adhere to the CDC guidelines for writing scientific nomenclature, such as bacteria and genes. Regarding the conclusion should be concise, and it should exclude any data or information that would require citation. So make sure to not have any citations, the conclusion section. You can have 1 to 2 paragraphs, but you should not have 1 to 2 sentences in the conclusion. Articles with 1 to 2 sentence conclusion will not be accepted. Regarding the writing of the numbers in the abstract, as I said, these are just formatting tips or formatting guidelines. If you're writing a number from 1 to 9, you should spell it out as 1. Do not write the number 1, but write it as a word, O-N-E, 1. You can write the number as a number if it's the case of measurements such as 7 millimeters and so on. Numbers that are 10, that are from 10 and larger can be written as numbers, as shown in the example. Regarding the citations, you should use square brackets only for in-text citations, and you can format multiple citations as follows. This is the square bracket, and then 1 to 4, and then end of the bracket. Or if you want to use citations that are not after each other, citation 1 and 3. The unique thing is that you have to use these square brackets and not the other type of brackets. Citations are not allowed in figures, tables, and figure titles. They could be included in the media legends or table cells. Check the media guide for instructions regarding the types of media you can add to the article and examples of how to add them. Also check the instructions for authors for more details about formatting. Just write to some of the, what I perceive to be some of the important or some of the relevant points. After that, you will be forwarded to add the references. You can use Cureus's automated tool to convert references and then review the formatting. Or you can add references individually. You can check the references section for more information. Also give you examples of how the reference should look, which is very helpful. Okay, after that, you will be asked to add some of the reviewers or invite others to review. You should submit 5 qualified individuals to review the article. Medical students obviously are excluded. Suggested reviewers will be vetted by editorial staff, so they will either be accepted as reviewers or not accepted. After that, it's important to know that Cureus will invite their own reviewers, which will be a minimum of 6 additional peer reviewers, making up a total of 11 reviewers, 5 invited from the author and 6 invited by Cureus, which ensures diverse input. 3 more will be invited every 2 days to have a timely review process, which is very helpful and is a part of the reason why Cureus does not take a lot of time in peer review and publishing resources. After that, you will have a summary of your article. Basically, a summary will be provided to give an outline of your article. Make sure to review each section and jump to specific areas for edits. If any reference issues are found, you will receive notifications about missing citation or missing references or incorrect formats. So basically, you will get a warning at the summary page that directs you to specific technical, let's say, issues or mistakes or errors in the input. For example, if you cited a total number of 6 references in your manuscript, you added only 5 or 3 references in your reference section, you will be directed to correct this error. Lastly, it's important to address all issues before submitting. Now, after that, you can review your article and submit it. Okay, I'm going to talk briefly about the preferred editing service. If you're submitting, for example, a review article, or if you're required at all, you should enter your payment info and resubmit the article when it's directed for the preferred editing service. Articles cannot be edited while deferred or while they're delayed. So unless you make the payment for the editing service, your article will not be edited. Will not be edited and will not start the review process. If third-party editing is required, as we said previously, for severe language issues, provide service name and upload the invoice of the service you purchased for the third-party editing during the resubmission. Okay, so here's an overview of the process. Firstly, the manuscript submission, the draft, the preliminary article review. It will move then to the peer review, revising and submitting, the final version, editorial review for the final decision, copy editing for all of the language and paragraph and manuscript editing of the wordings, basically. Then having your research hopefully worked and published. I'm going to do a very quick demonstration how to do that. This is the author guide in the Cureus website. Is my screen clear?
Yes, it is.
Okay. So first of all, you start by either signing in if you do not have an account. You can sign in through LinkedIn. You can, join if you do not have an account. Yeah. By your email address or LinkedIn or Google or Facebook. However, I already have an account, so I'm going to sign in. Okay, so start by submitting research. I had this manuscript written through ChatGPT in order to give a practical demonstration, but it's not an actual research. I'll start by submitting research. Then they will ask you, have you read the author instruction? If you haven't, it's not very long. It's important to read, so go to read the author instruction. Okay, so they give you an instruction or a tip, write and format your article outside line, as we said in Microsoft Word, for example, before copying it into Cureus. Know your responsibilities as a submitting author. We discussed this already. Know that they do not accept the following article submissions: medical student, resident, or physician burnout, and many reviews. Now, we should get started. The first question you will have is this a competition entry? So, no, this is not a competition entry. As I said, they have often post competitions, so you can follow up their news page to see that, and then we will save and continue. Is this a channel article? So basically, has your organization or department encouraged or directed you to publish in Cureus? As I said, certain organizations, departments, and medical societies or scientific societies have channels through which they publish their articles in Cureus. I'm going to choose no, this is not a channel article. Let's even continue. Are you submitting to a Cureus collection? Now, if you have a scientific collection or call for submission to a specific topic, you can choose one of those. I'm going to choose no, this is not a collection article. Save and continue. About the image. Okay, what type of article are you submitting? Now, make sure that you select the correct article type, because once you choose it, you cannot change this information. You have the options here: original, view, case report, technical reports, and editorials. Going to go with the original article, and then save and continue. Now, here's what we have so far. This is an original article, is not entered in a competition, and is not associated with a channel. This is the last chance to change this information, so you have to be very careful using this correctly. I'm going to exit at this point because I already entered the information. I can't get back to this starting point after I submit the other information. So I just wanted to show you this first step, but I'm going to go back to the article that I submitted previously, so we do not consume a lot of time copying and pasting the information. Now here's the article I submitted previously. Now after the interface I showed you previously, which as you can see here, it's locked. I cannot go back and edit it. The system directed me to the title, which is title, abstract, categories, and keywords. Now first, what is the title of your article? The title should be entered in APA style title case. It's really useful because they have some info, so you can go check some of the stuff you're not very sure about. You can read about the title case capitalization. But as I already told you previously, you just have to have the first word be in capital and capitalized all of the large words. And for the words that have 3 characters or less, they do not have to be in capital letters. So here you have the off and on and in. You can also see an example how it should look like. For example, how should I format my article title? The correct way is here. It's incorrect to have it in all caps or write it in a sentence case. Only the first letter, the first word having the capital letter. And then you can check for other information, other tips on how to write some of the stuff. Just wanted to let you know about this how-to and info tab so you can benefit from it, inshallah. Now, after adding the title of the article, I will save and continue. It will take me to the abstract. Now, as I said, the abstract of the original article is the only place where you can add subheadings, as I did here, and it's subheading. Make sure that you do not format the entire thing with the body as a subheading. No, do not do this. Make sure that you only format subheadings as so, and the content of the body of the abstract normally. Now here's the ChatGPT made up abstract of this article. As I said, it's only done for demonstration. You can check the character below. So our maximum number of characters is 3,500. I only did about 900. I'll save and continue. Now, you have to select the categories. Since this article is about the management or the impact of the DASH diet and exercise on the blood pressure of hypertensive patients, I choose cardiology, family/general practice, and internal medicine as the categories, but there are tons of categories in which you can choose from. Save and continue. Of course, the categories have to be relevant to the topic. Now, after that, we should add the keywords. You just enter the keywords. Let's say preventative. Preventative care, for example, and add it. You can see I chose 6 keywords. I can add 4 more because I have a maximum. I could add up to 10 keywords. All of the keywords should not be long, maximum 3 to 4 words, and they should be relevant to the topic. After you add the keywords, save and continue. Then you will move on to the co-authors list. Please, while you're submitting your manuscript, read through all of those very carefully. I'm not going to read through them due to time constraints. Most of the important information I already mentioned in the presentation. When I first added the name, my name was up here because, as I said previously, so the submitting author is by default put into position of the first author. But I changed this, assuming that the FN1 and LN1 just made up first author is the first author and not the submitting author. Now here's how you can add the author. Assuming that the author already has an account in Cureus, you can just add their email, for example, made up email number, let's say 10, at gmail.com. If there is an author with that name, their name will pop up here, and then I can click on it and add them easily. However, if the author is not present in their database, I can just write the email and then click search, and then add the first name manually, first name 9, then last name 2, let's say, for example. Make sure to write the name correctly. And here you can add the middle initial, for example, let's say H. Add the specialty, for example, since it's about hypertension, I'm going to add cardiology. The affiliation, once you start writing the name, you'll have names of hospitals, universities, etc. pop up. So I'm going to come up with the native name, university. Make sure to write the affiliations correctly. If both of the authors, wait a minute, I'm going to write this incorrectly to show you how. Okay, department specialization, let's say vascular medicine. No, okay, vascular surgery. Country, United States, and then enter the name of the city and author. Now, assuming that the first, second, and last authors are all from the, let's say, the Telegeriatric Research Fellowship. Okay. And okay, update. and I enter the affiliation as follows: TGRF in the first and second author, and the whole name Telegeriatric Research Fellowship for the third author. They're all from the same institution. I should edit this and make sure that the affiliation is written in the same format for all of the authors that are affiliated with the same institution. So as TGRF in author 1, author number 2, and the third author as well. Okay, and then after you enter the authors, you should save and continue. You'll have a pop-up asking you to make sure that accurate and uniform author affiliations are required, asking you to check whether you have entered it correctly, and that because Cureus is a central PubMed Center required, it is required to have all of the affiliation written uniformly, which is just the point I demonstrated to you. If you didn't check, go back and check, or check yes, all authors' affiliations are accurate and formatted consistently. Proceed. Now, here you should add the author contributions. Now make sure that all of the authors, click on the drop-down menu. As you can see, they have the authors listed by order from first to last author, and they give you options to choose basically which thing the author contributed to. It's required that all of the author agree to be accountable for all aspects of the work, and that they will review the final version to be published. Then you can add from whatever they did. For example, the first author contributed in all aspects, reviewed, drafted the manuscript, did a critical review, had substantial contribution to concept or design, acquisition, analysis, or interpretation of the data, and then apply. And then as such, for the second, third author, which I'm going to check with you now, agree to be accountable and will review the final version. Let's say this author supervised the work, they drafted the manuscript, and they helped in the acquisition, analysis, or interpretation of the data. Right? Save and continue. Now, here you will add if you have any acknowledgements that you would like to add. You can check no, I do not have any acknowledgement, or yes. So two important acknowledgements that you can add. The first is stating that the data, analytical methods, and study materials of this research article are available upon request and on reasonable request or on reasonable request. You can add that the first author, second author, which is listed as the second author, have contributed equally to the work and should be considered co-first authors. For example, this study was supervised by a doctor or senior researcher who did not meet the ICMGE criteria of authorship. We can say that Dr. So-and-so helped. This is poor drafting of the wording, but we can say that helped supervise this article or this research. These are the points that can be added to the acknowledgement. Now save and continue. Yes, here you will be asked to review the ethics statements, conflict of interest, disclosures. Now, first, you'll be asked whether human subjects were involved in this study. You can say no if it does not include humans, or yes, the study involves human participants or live human tissues. If you're not sure whether any of the co-authors have potential conflict of interest, you can click on this. It's going to generate an email that will be sent to the emails of all of the other co-authors. You can choose to send a copy to yourself, which is a message from undefined. Do you have any disclosures for your first co-authored article? This is a generated message. You can edit it, obviously. Then you can send the email to the co-authors so that they can state if they have conflict of interest or not. If you're already in contact with the co-authors and you know that they do not have conflict of interest, you can just say no, they do not have conflict of interest. Now, you have to confirm that an informed consent, whether verbal or written, has been obtained or waived, particularly with retrospective case reports and small case series, and confirm that no identifying information, whether in the texts or the images in the article, are available. So no information should be available that can identify a certain patient. After that, after you confirm those two required points, include the IRB and ethics committee information. Now, this popped up because I chose previously that there's human subjects involved. Just note that you will be asked multiple questions whether animal subjects were involved or not, which I encountered previously, but it's as you can see, the interface is very simple, it's not complicated, so it can be can go through it inshallah without any problems. Now, the institution review board, I just gave it a made-up name, ABC University IRB. The approval number is XYZ. And then a statement indicating approval of the research, which is non-identifiable human data and samples used in this study were sourced ethically, and their research use was in compliance with the terms, etc., etc. That's just an example. You don't have to write the same sentence. And then after you finish from the disclosures, save and continue to the next part. Here, you're asked about whether animal subjects were used or not. I choose no. You can choose yes, and then move forward with the same kind of steps to disclose conflict of interest and include the IRB and so on. And you can also contact co-authors to obtain potential conflict of interest through the same pop-up. Save and continue. You can read through this in details. It's basically about the ethics statement and conflict. Read the sentence, read the paragraph, sorry. And you can click that I understand that I alone am responsible for including all co-authors and all co-authors' conflict of interest and disclosure statements. So basically, those section payments, financial relationships, intellectual property, and other relationship are going to ask you if you received payments from third parties, if you have financial relationships with whomever you're conducting this research for, or if you have intellectual property, any patent or anything related to that. I'm going to move quickly through those. Please make sure to read thoroughly before you answer. Just read the paragraph. As you can see, the interface is very easy to move through. Just disclose if you have any financial relationships. Basically, a conflict of interest disclosure that you are filling for yourself and other co-authors as well. Okay, after that, we will move to the introduction. Now, the introduction is copied and pasted from a Word. I copied it prior, not to consume time. As you can see, the citations are in square brackets. The normal formatting, starting with sentence format, having one space after the sentence, between a sentence and another, and ending the sentence with a period or a dot. As you can see here, just standard formatting. You can drag this window down to lengthen your text area, move it upwards. Anyway, save and continue. Enter the introduction, and then enter the materials and methods, result, discussion, conclusion, and appendices if applicable. Now, because I choose an original article, these are the sections that appear to me, but it will be tailored to the type of article I choose. For example, if I choose an editorial, those sections will differ and so on. Now, as we warned previously, do not include the title and methods. do not include the title and just immediately add this. So if you copy your materials and method or introduction or whatever section like this with the title first thing and then the paragraph or the content, this is wrong. Let's make sure to delete this and just enter the body of the text immediately. Save and continue. Okay, so for the result, I added this table. Here's how I added it. For example, I have a table here that I wanted to add. I choose the insert table. And then I copy the table. Just a minute. I copy the table from my Word document. And then paste it here. And then I add the description down here. For example, the table 1 talks about the, let's say, mean blood pressure readings. And then I will add the legend. As you can see, enter your legend here. Optional, please include any abbreviation, definitions, and reference citations here. Okay, as you can see, there is the PP abbreviation, there's blood pressure, and the millimeter mercury as well. And then after that, I will insert. I already did insert it, so I'm not going to insert it now. I'm just going to show you how it looks after it's inserted. See, here's the table. And then the table 1, systolic and diastolic blood pressure values. The BP is short or abbreviation for blood pressure. mmHg is short for or abbreviation for millimeter mercury. And then down, I added this graph. Again, adding a graph, insert figure. I can just select it from the computer or drag and drop. Again, I can add the title here, then the legend down. Then I can edit the figure if I want to. Again, all of those are made up for the sake of the demonstration. So these are not actual information. They're just made up by ChatGPT. Save and continue. Lastly, add the discussion. Same formatting tips, nothing new. Add your conclusion, which can consist of 1 to 2 paragraphs and not 1 to 2 sentences. It should not include any citations. And then move to the next. You can, okay, so here you'll be asked if you are including appendices. For example, if you want to include any other information that are relevant but are not to be included in the previous sections. You can choose yes, I'm including appendices, and then put your appendices, or choose no, I'm not including appendices. Save and continue. Okay, we're almost done. We will add our references, which you can add through the launch reference converter or through the reference converter. You can just copy your reference here. 7. Okay, for example, this is the citation I want to add. I can copy the name, the authors individually, put them, or I can simply go to Google Scholar. Obviously, there are a lot of methods in which you can cite using Mendeley or using Zoetrope, I think, and other apps or like Chrome extensions. You can also use Google Scholar. Go back, write the reference here. Make sure to include the DOI, which is here, the DOI. Starting from the number starting from the number 10 or 0. Convert reference. So you can see it noticed that there are duplicate references. It's important to note that the journal wants you or they require to have only, if you have more than 3 authors, to include the 3 authors, then et al. So first author slash comma, second author, comma, third author, comma, et al. And it will not accept this long set of author names. It's going to show you as error. However, you just correct it and add it all after the first 3 authors. If you do not include the DOI, it's going to show you this as an error as well. If you write the DOI starting with the HTTPS, it's also going to direct you back to edit this, or if you start it as a DOI. So do not include this section, only the numbers starting from 10 or 0. Okay, as you can see, it showed me that they have duplicate references, so I'm going to remove this one because the formatting here is not similar to the one required by the journal. So I'm going to delete this. I can edit it as well. Are you sure you want to do this? This action is irreversible? Yes. You can add the reference manually. So choose if it's an article, website, complete book, book chapter, whatever. Then you can add author names, title, source, year, etc., etc. See, DOI do not include DOI or HTTPS. Or you can add URL, which is the link in absence of DOI. Also. Okay, so here you add the people you want to peer review. There's a set of made up names and emails, made up affiliations, but just add the people similar to how you add authors. So just write whatever email and then search. If the interviewer is already in their database, it will pop up. It's very easy. If not, you can add their information manually. Then they will appear here downstairs. Sorry, down, I mean below. You can edit or delete viewers as you want. Save and continue. Okay, we're almost done. We're at the summary. We should go through all of those. As I said previously, if there is an error, a red pop-up will come here, which will direct me to an error. Then I will see somewhere here a red pop-up. For example, when I entered the references, I did not enter it correctly. So a pop-up appeared, a red warning sign appeared, where the references appeared here. It directed me to edit the references. And it's very useful because it shows you exactly what you did wrong and how to correct it. Then you can go to edit. Just immediately edit the part it showed you needed. The system showed you needed editing, and then go back again to the summary. Now, after this, when you're satisfied with everything, go ahead and select next to move to the next step, where you will review your article one last time before submitting. Going to go to the next page. You made it. Please review and submit your draft. I am not going to submit it because, again, it's made up work for the sake of demonstration. You can go back and review it and then submit your article. And now we are done with the preview, with the demonstration. Going to exit. I can delete it if I want, and I can go back and edit it if I want. Delete the article. Okay. I want to go back to the going back to the presentation. Now I published my article. Alhamdulillah, I'm almost done. What should I I'm not going to go through the last process because I just realized it's mostly here. Just going to summarize it. After I submit my article, the process is basically going to be this, consisting of this line. Now I've written the draft of my manuscript and submitted it. The article is going to get a preliminary review by an editor. They will decide whether it fulfills the basic criteria, number of references, number of authors, type of articles that are accepted, all of the basic criteria that we just mentioned. Then if it's accepted at this point, it will move to the peer review. When it's at the peer review, it's going to get reviewed by multiple authors. As we said, at the stage of the peer review, if 2 reviewers have completed a peer review, the submitting author can edit have basically 3 options. They can edit the manuscript and submit it for a re-review. So they can, depending on the 2 completed reviews, they can edit the data, edit the manuscript, and then resubmit it for another review. Or they can do their editing alongside the reviewers and while waiting for other reviewers. Yeah, basically those are the 2 options that the author have. So the author can end the review as well if only 2 reviews have been made and they submitted it for re-review and it was accepted. The author at this point can end the peer review process. So yes, here's what the author can do: revise and submit. So revise the comments that the reviewer had and submit the article again. After that, after the revision and submission, after the peer review, the editor is going to have an editorial review. So basically a final review that's going to decide whether this article is submitted or if the article will not be submitted and needs more editing, or if the editing did not answer the concern of the peer reviewers. If hopefully your article is approved, it's going to enter the queue and it's going to be awaiting publication. Basically, it's going to be edited for the formatting by the copy editor. And finally, hopefully, inshallah, it's going to be published. Okay, this is the step-by-step review. It takes 4 weeks. Okay, I'm not going to read most of it, but just the important stuff. So the result of the review is either it's approved or you need to pay for the service, for the fee, for the preferred editorial editing if it's required, or for a third-party editing service. It could also be deferred for revision if it needs one of those editing services, or it's going to be rejected if it does not qualify the basic requirements of a research, if it has some methodological problems and scientific problems, or you're going to be blocked. Hopefully not. Authors can be blocked if they have major plagiarism issues, or if they stall the work of another author. After that, your article will be accepted, hopefully, if it meets the criteria, if you already paid for the editing service or the professional third-party service if it's required. Yeah, this is what you can do after its preliminary has been accepted. You can edit and request a re-revision. You can wait for the other reviewers, or you can revise, address, comment, and submit for approval with explanation after waiting for the reviews. Final editorial decision. The editor basically conducts a final review, the associate editor, to confirm that the article is suitable for publication and that all of the peer review comments were acknowledged and addressed appropriately. Finally, the associate editor's decision. There are 3 decisions. If the revisions do not reflect review feedback, the article is going to be deferred, it's going to be delayed, and sent back to the peer review stage. Authors are notified at this point and must revise further. Rejected reviews return the article to peer review, and articles must meet Cureus review requirement to proceed. So you're going basically to go back to the starting point. And hopefully your article is approved. You just wait for article to be published, and it's going to go through the copy editing and then published after that. Okay, we've reached the end of our presentation. Here are the references. There's Cureus official website, the ICMGE criteria for authorship. This is the website where I get those icons from if you want to use them for presentations. By the way, this presentation was done using Prezi, and this is the website with the APA style title page. Do you have any questions or tips or comments?
Thank you, Dr. Amna, for the detailed information how to publish the articles in Cureus journals. And actually, I think you explained in details. I don't think there is anyone who has any questions. And thank you for listening and for your patience, doctors. So I will just go very brief in the last presentation, which is in how to publish an app on an Android Google Play Store with the 2024 criteria. Can you see my screen? Okay, so there are some new criteria in how to publish a Google Android app in Google Play Store. So we will discuss the key changes and the new requirement in 2024 Google Play Store. Things to consider before you publish an Android app on the Google Play Store, Google Play Console, developer account, and how to set up a Google merchant account, how to create an application listing and details and rating. So we will start with key changes and new requirement in 2024 Google Play Store. After November 13, 2023, new personal developer account must be for closed test before app publishing on Google Play. So you have to have at least 20 testers is required who must have used your app for at least continuous 14 days. Actually, this process might be challenging, but it's important to conduct, to give them chance to use your app and to give you a feedback and to avoid rejection of your app and minimize technical issues. Things to do before considering your app publishing in Android and Android app Google Play Store. So before you're publishing your Android app, prepare a high quality screenshot and description ruled in Play app or also ruled in Play app for security and ensure your app size is under the 150 megabyte to avoid needing to reduce its size. So basically, this is not how to create an app, it's like how to upload your app. So you have now your app is ready with the, like the requirement, which is one of these requirements is your app size should be under 150 megabyte. So one of the primary tip is to create for publishing is to create a Google Scholar, to create Google developer account on the Google Play console. Actually, to publish and manage and monitor your Android app, which is that costs about $25, and it takes about 48 hours to active after submission. You will sign in with your, how to do this step. You have to sign in with your Gmail account and provide your details, information, or your organization information. So this is how to create a new Google account, and this is to fill the information. Now you have to set up a Google Merchant account. This is to enable an app purchase, and you need to create a Google Merchant account, which link to your Google Play console account as well, allowing you to track and manage your app sales and financial reports. And this is how it looks like when you do this step. Creating an application. After linking your merchant account, go to menu, which is like all application, and select create application to start process. Fill the basic details like app name, which is like it should be about 30 characters, default languages, type of app, and whether it's free or paid. Ensure your app complies with the Google policies and laws before clicking create an app to finalize. And this is how to looks like. Create an app, and this is how to write the information that's required. App Store listing details. To upload your app on Google Play, start by filling an app listing information after clicking create an app on the app on the Play console dashboard. You need to provide the app name, short description, full description. So short description doesn't not exceed 80 character, 40 full description not exceed 4,000 character, using relevant keywords. Prepare high quality images for your app, including 2 to 8 screenshots, icons detailed about localization, app type, and contact information. Don't forget to add the privacy policy, which is very important to save your information and your contact information and other details. And this is how it's look like when you try to do this process. Content rating to avoid being, this is the 2024 criteria and should be done. So it's to avoid being removed from the Google Play Store. You must complete content rating questionnaires for your app. Start by going to your app dashboard and selecting the content rating options. For those 20 people that should use your app before being published, it could be your families, your friends, your colleagues. It doesn't need specific people. So anyone could, you can choose any 20, like people, whatever they're who are interested in using the app that you created. So it's not a big deal who will use this app. Fill in the basic information about your app in the 3 parts: categories, questionnaires, and summaries. After completing the questionnaires review and summary, of your content, rating, and click submit to finalize your changes. And this is how it looks like when you would like to do this process, the category, the content rating. now it's like everything is ready. We did we create the Google Console account, the privacy policy, and now we are ready to create and upload our Android app to Google Play. So first step is to publishing your app is uploading the app APK, which is stand for Android Package Kit. So this is basically that, as I mentioned earlier, that we have our app is ready and we have to upload our app in Android Package Kit, which is like a file or folder. So you can send it through this kit to the Google Play Store for reviewing it. So also this steps try to make sure that the Android Package Kit, it's like from you know, like accurate and it's like safe to upload your details and your app on this kit. Try to make sure that you choose the right kit for your app for your privacy and mainly for your privacy and your app details. You need to choose the type of release, this is an optional step. After selecting the release type, go to the dashboard and click Create a new release to upload your app bundle and details. This is how it looks like. This is actually the final step for uploading your app. This is in very brief in how to upload your app. So as I told you, this is for your app is ready. So we're not telling you how to create your app. Your app is now ready, and just is like the important point that in 2024 that you must have 20 people working on your app for at least 14 days, 2 weeks, and they give you comment and feedback, which is like, this is to ensure that like to avoid the rejection of your app and to have, if you want to edit before you publish it and you make it like favorite for people to use it, for many people to use it. These are a website and how to, like if you want to see how to more details how to publish your app with the 2024 criteria. One more thing I want to mention that Dr. Amal, she gave us lectures about how to create an app. It was a very nice lectures, and she gave it in details. So you can go to the telegeriatric app and check for Dr. Amal's lectures on how to create app if you are interested to create app and to publish it. Thank you for listening and for your patience.
Thank you so much, Dr. Hayfa, and all the presenters. These are great presentations. Thank you so much, all of you. Any questions for any of the presenters, any of the topics, or any comments?
Thank you for patience and for your listening, and we hope you enjoyed our presentations today. And thank you for Dr. Mohamed, Dr. Huzifa, Dr. Amal, and Dr. Amena for their presentation and for participation in today's meeting. And thank you, Dr. Nader. We are very grateful for your time and your help and support for all of us. And we wish best for all of you.
Hello.
Hello.
A
Go
question
ahead.
for Dr. Amena. Do we have can we have an access to the presentation, or do we have an access to it through the app itself?
Sure. I think it's already in the app. If not, I will send it in the group, inshallah.
Okay, thank you very much.
You're welcome. If I can just add, Dr. Umar Bakri in the comment said something about Cureus being taken out of the Web of Science, which it has been outside of the, not indexed in the Web of Science for a while. And he also mentioned something that I did not know about or read about. It's that Elsevier is concerning a similar action. So first of all, thank you, Dr. Omar Bakri. I just wanted to let everyone know that so they can make an educated decision when they're choosing Cureus or other journals. So Elsevier is also considering not indexing Cureus. I just wanted everyone to know. Thank you very much, and thank you, Dr. Amir.
Thank you so much again for the comments and the updates. And thank you for the presentations. It's important to know how to do the steps, and you can apply the same steps as Dr. Amna demonstrated to apply to other journals. So look at the author guide and follow them, and you'll be in a good shape. Some of the journals will ask for fees, ACP fees or something like that. So in the past, some of the fellows contributed together, and sometimes we can get some funds for covering these fees. Some of the journals will offer discounted fees or free publications, depending on your location. Some of the countries that will be listed like in their website where they can offer support or to waive the fees for publication from these countries. So when you have the manuscript ready to submit, look at the journal that you want to submit and look if there is any discount or any waiving of the fees for some of the fellows might be helpful. So thank you so much again, all the presenters. These are great presentations. Hopefully this will help some of you there, if not all. Next part or last part is the updates. Any updates as far as any projects, any new ideas, or any presentation? I know next week the North America Family Primary Care Conference will be done, and we have 3 posters that will be presented there. Excuse me. Any other? If no other comments or questions, in general, any questions about the fellowship? If not, I'd like to thank you so much, Dr. Hayfa, and your team, all the presenters, and I'd like to thank all the attendees from today's meeting and those who will come and look at the recorded session in the future. Thank you so much, and have a wonderful day. We'll see you next week. Assalamu alaikum. في أمان الله.
جزاك الله خيرا دكتور نادر and for all the جزاكم الله خيرا موفقين جميعا. Good luck for all of you.
جزاكم الله خير.
Thank you, Dr. Nader.
Thank you, Dr. Nader.
Anytime. Thank you.
Thank you, Dr. Nader.
Thank you. Have a good one.